So now we'll just take a little bit of cream, and you don't want to use oil because it's usually too slippery and kind of greasy. You can if you want to. I like cream, and I'll just usually put it on my elbows. And now we're going to start up here around T1, and I'm going to go along what we call the spinal gutter, which is just adjacent to the spinous process. And how's that feel, Julie? You want that deeper or lighter?
I think a little lighter. A
little lighter, okay. And we do this in 3 sections. We do the upper and middle part of the back. How is that? Is that better? Mm-hmm. You want it lighter or harder?
That's good.
Okay. And then we're going to do the thoracolumbar area. And I'm going along the intertransversarii, rotatories, iliocostalis, semispinalis, etc. And we're going all the way into the very lowest part of the back, but don't hit the sacrum, just barely touch it. And then we also want to go to the other side and do the quadratus lumborum. This is more efficient to do the other side. And now we're going to show you some close-ups of what this looks like. So here's the spinous process. And of course you want to stay off the ribs. So you find the spinous process and you go just lateral to that about a ½ inch. And you sink your elbow in there. Do you want that harder or softer, Julia?
That's good.
That's good, okay. Notice how I keep asking that. It's very important, because you want to make sure that you're not going too deep for the patient. And now I'm going into the second section, which is the, see how I'm moving down, going into the lower thoracic and middle thoracic spine. And then I'm staying in this gutter, notice that, but I'm not going on the spinous process. That's very important. And then I go lastly into the lumbar area of the iliocostalis and longissimus muscles. And then I do the other side, again staying off the crest of the innominate bone, the hip bone. And you can move up a little bit and do the whole length of this quadratus lumborum, but make sure you stay off these lower thoracic ribs, because that's very uncomfortable. And that's how we work on the muscles of the upper back, or the upper thoracic and lower cervical spine, the middle thoracic spine, the lower thoracic spine, and the lumbar spine, and treat all those muscles to make sure that all of the vertebrae and the ribs are moving normally.